Hello everyone, my name is Janika Shah. I'm an eye specialist from Singapore, came here for advanced training in medical retina at SafeSide Institute and Sydney Eye Hospital. I would like to give a brief introduction about age-related macular degeneration, which is the leading cause of blindness in developed countries. It causes blurring, distortion, and eventually loss of central vision. There are two types of macular degeneration, dry and wet. Dry macular degeneration is the most common type, but it does not affect vision until it becomes very advanced. The wet form, though less common, is more severe and develops more quickly. In this form, new blood vessels grow widely beneath the retina and can bleed or leak fluid. Severe loss of vision can occur if they are left untreated. Unfortunately, there is no cure for macular degeneration, and all efforts are directed to prevent further loss of vision or to maintain useful vision for as long as possible. This is done by injecting medications known as anti-VEGF in the back part of the eye, and they act by reducing leakage from the blood vessels under the retina. Currently, there are 3 anti-VEGFs available, and initially they are injected monthly to preserve vision. As this is not a cure, majority of patients require lifelong therapy at 1 or 3 monthly intervals. I would like to share the recent developments in macular degeneration. Firstly, from the Fight Retinal Blindness Registry, I would like to share the analysis of 10 years treatment outcomes of anti-VEGF in wet macular degeneration from 2 regions, Australia, New Zealand, and Switzerland. In this analysis, it was found that the visual outcomes was reasonably better in Australian group, whereas the Swiss group had 3 lines drop in their vision. With regards to number of injections, in first year, Australian group received around 7 injections and Swiss group got around 6. And from third year onwards, Australian received twice as many injections as in Swiss groups with fewer visits. This suggests that the treat and extend regimen, which was followed in Australia by treating lesions before they reactivate, yielded better results than treating lesions only when it's active. Another latest development is the recent approval of newer anti-VEGF molecule known as Vivo. The main advantage of this new drug is its effectiveness with longer treatment interval of 12 weeks as compared to 4 to 8 weekly with current medication. However, 1% of the people who received this new molecule developed inflammation and occlusion of retinal vessels, which caused permanent loss of vision in half of them. Thus, at this point, this new molecule is used only for eyes with wet macular degeneration, which remain swollen despite maximum treatment with the current VEGF inhibitors. So to conclude, earlier the patient gets diagnosed and treated, best is their visual outcome. And this is one of the reasons why it is important for older Australians to have their eyes examined. If you're over 50 and notice any changes to your vision, please ensure you get your eyes examined by your ophthalmologist. Thank you.